the COVID-19 pandemic, dentists are only seeing patients in cases of emergencies. But for other, more urgent care, some dentists now are finding ways to keep their patients safe. News Channel 9's Julia LeBlanc spoke with one family who found a solution, and she joins us now live from St. Joseph's Hospital this morning. Julia, good morning.
Good morning, Jennifer. We spoke with a family who had their baby, Elijah, here at St. Joe's 5 months ago. Elijah was born with a birth defect, and every week he travels 4 hours to and from Rochester because the doctors there are the only ones that can treat him for that birth defect. But when the whole pandemic started, the family wasn't sure how they were going to continue that treatment since most dental services were put on hold. But now they get that treatment out of their car.
Oh my gosh.
This has become the norm for Anna, David, and baby Elijah. Each week, they make the 2-hour drive to Rochester, park curbside, and their doctor meets them out front.
Never in my life did I think I would be taking my baby to a dentist appointment to begin with, let alone weekly drive-through dental appointments.
5-month-old Elijah was born with a bilateral cleft lip and palate. At 2 weeks old, he was given this appliance called NAM, a nasal alveolar molding device, and needs to be worn within the first few months of his life to prepare for corrective surgery, an exception for dental treatment during COVID-19, where dentists are only handling urgent or emergency cases.
It's really looking good.
Yeah. Dr. Erin Shopey wanted to limit the family's exposure. She meets them outside in full protective equipment, adjusts the device inside, and then sees them off.
I didn't feel super comfortable having the family and the baby come into the hospital or into our dental center if we didn't need to have to do that.
I think it was more for ourselves, actually, our ability to care for him if we were to become sick.
COVID-19 could have halted this treatment during a critical time in Elijah's life. Dr. Shopey says the implications could have impacted not only his appearance, but his speech, his ability to eat, breathe, and even hear. Consequences Anna and David were sure they'd have to face because of the pandemic, which is why they're grateful a 4-hour drive is the only thing standing between Elijah and a better life.
It really made me empathize with parents living in other countries where maybe because of the way the healthcare system is or their economic situation, they might not be able to get treatment for their children at the time frame when it's most critical.
Dr. Shopey says dental offices are open right now, mostly to handle emergency cases so that people don't head to emergency rooms like this one to get that treatment. They're also putting off a lot of surgeries to preserve ventilators and other things like anesthesia for those who need it for COVID-19. Live in Syracuse, Julia LeBlanc, News Channel 9.